Good morning, everyone, and welcome back to Instagram Live with Intimate Rose. Today, I am joined by Andrea Martin from Andrea Sexplains It All, and we're going to be discussing breakthrough bleeding while on hormone therapy. So if you have any questions as we're going, please don't hesitate to put them in the comments section. And we're going to be doing these every other week now. There she is. This time on your calendar. We'll always save them so you can access them later. But today the topic is bleeding while on hormone replacement therapy. Hey, Andrea.
Hi.
How are you?
It's lovely. How are you?
I'm doing very well. I've been quite sick, so my voice is still a little bit off. But
Oh no. Good. I know there's a lot of people sick, and I think it's coming for me, but so far I've avoided it.
Well done.
For now. Give it a minute.
Yes. And we haven't yet settled on our name for our recurring show, but for now I'm liking Andy and Mandy Talk Vaginas. I think that might be the winner.
I think it's the only way. The only thing that makes sense.
It's the only thing that makes sense.
Oh, I'm such an idiot.
Oh no. So our weekly question is, I'm on hormone replacement therapy and I'm bleeding. What gives?
So this is super, super common. I was actually just looking up different studies to see like how common it is. And one study said up to 40% of people that will start hormone therapy will have some kind of bleeding. So in general, when we talk about vaginal bleeding, obviously before menopause, very normal, happens as you cycle. We expect it to happen. But after menopause, you're not supposed to bleed anymore. So it always rings alarm bells, and we just have to kind of see what's going on there. But especially when it comes to hormone therapy, we have some leeway here as to, why somebody might be bleeding and what we can do about it. So in general, with hormone therapy, you've got your estrogen, and the one thing estrogen does that we don't necessarily want it to do is it stimulates the lining of the uterus to grow. So if you have a uterus, you've got to take progesterone at the same time to protect that lining and keep it from growing. Well, sometimes when you start hormone therapy, even though you're doing it right, you're taking both the things, the estrogen comes floating down in your body and your uterus is like, oh, yes, I remember this. We grow. We're supposed to grow. And then you get that little bit of spotting or bleeding, and it's okay. Like, you need to let us know, whoever prescribes the medication. A lot of times, especially with either just starting it or if you're changing doses, that you might have some spotting and bleeding and this and that. So if it's within the first 4 to 6 months of a dose change or starting hormone replacement therapy, we've got some time there where either we can just kind of ride it out and see if your body just needed a hot second to get used to it and it'll go away, or we make adjustments to make it stop if it's not stopping on its own.
That sounds really reasonable. And I have had a lot of patients start that and be really alarmed. And oftentimes they've had biopsy recommended. Do you find that you wait until after that 6-month kind of grace period to let the hormones restabilize to order the biopsy? Or are you ordering it early on, or is it dependent on the patient in front of you?
It's dependent upon the patient, but for the most part, I'm waiting because we're pretty sure we know why this is happening. So if you look at the statistics, it's about 6% of women who have any type of postmenopausal bleeding end up going on to develop endometrial cancer, which is what we're concerned about in the first place. And the reason we're always concerned about bleeding after menopause is when then you look at women that have been diagnosed with endometrial cancer, 90% of them at some point had vaginal bleeding. So that's why when someone bleeds after menopause, we're like, oh, you got to tell us, what's going on there. However, when you've got an obvious cause in front of your face, like starting hormone therapy, we've got time to work with this. And again, if somebody's, I'm not just going to let them continuously bleed for 6 months and be like, well, oh, it didn't go away. Like, we'll, like I said, we'll make adjustments. So maybe if it's not that bad, it's light, it's here and there. And like I said, we give it some time and maybe it stops. If we're like, all right, it's been a couple months, this isn't budging, then maybe we need to increase the progesterone dose a little bit or decrease the estrogen dose a little bit just to kind of regulate things and get that to knock off. But if you've tried all kinds of things and you're just like, this is not stopping, then yeah, we've got to do some more digging and find out what's going on.
That makes perfect sense. Are there other symptoms that patients may experience during that kind of 6-month readjustment grace period?
Sure. I mean, anytime you start hormone therapy, I would say some of the more common symptoms are like breast tenderness that can happen. Bloating can be very common, and that is one where if you just stick it out, it tends to go away. I know people get very afraid of like weight gain. You're not going to gain fat from hormone therapy, but you could have some, fluid retention and, that feeling of bloating, which is very uncomfortable. But if you give that time, it usually, again, kind of evens itself out.
Perfect.
Yeah.
That's so wonderful. Thank you so much for sharing. Does anyone that's joining us live have any questions? I haven't seen any come through. So this series will happen every other week at this same bat time, same bat place. Maybe we'll settle on a different title, but for now it's Andy and Mandy Talk Vaginas.
And actually, speaking of vaginas, I'm just kind of thinking, just, to delve into this more, sometimes the reason that you have some bleeding has nothing to do with the hormone therapy itself. So there's some other issue, some other things that can cause bleeding, like, say for instance, you started a blood thinner. That can happen for people, and then they'll have vaginal bleeding, which is very obnoxious. Polyps are very, very common. So polyps are like these little benign growths of the uterine lining. It looks like it has like a little stalk, and then it kind of bulges out, and they're obnoxious. They bleed so easily, and they cause that, like, spotting and this and that, and it's like, why? I was fine and now I'm bleeding again. They're benign, but they're very annoying. So sometimes we find those and we can remove those, and they're much more common in women in like their 40s and 50s. And then another thing that I will see is the blood isn't coming from your uterus. Maybe it's coming from the vagina itself. So if you have, for instance, that genitourinary syndrome of menopause, the really long term for like vaginal dryness and thinness and irritation, sometimes the skin gets so thin that it can get little abrasions and you'll bleed from that. So you actually need estrogen to treat that.
Absolutely. And plenty of lubrication during intercourse. Yes. and speculum exam. We did have another question that's just the gold standard question. What are common symptoms of perimenopause? 47, still bleeding every month, but could it be perimenopause?
Absolutely. I more often say, what aren't the symptoms of perimenopause? You can kind of attribute almost anything to it, which makes it all the more frustrating. But your most common ones are like the hot flashes. You can have night sweats, trouble sleeping unrelated to temperature, so difficulty falling asleep, difficulty staying asleep, mood changes, like you're feeling more irritable. People say a lot, like, I feel less resilient. Like something comes my way in life that I used to just shrug it off or whatever, and now it's like I want to cry, or I'm pissed off, or I just like can't let it go. You can have increases in depression, anxiety, changes in skin, like drier skin, pain with sex, vaginal dryness is very, very common. Gosh, you name it. Like, pick a body system, it can be influenced by perimenopause, but especially, they said age 47, I believe. Yeah. So that the average age of menopause in the United States is about 51 and a half. There's this misconception that, perimenopause and menopause symptoms, they don't start, or they don't really count until your period stops and goes away. So you're cycling regularly, but you can absolutely be in the throes of perimenopause. There can be a lot of ups and downs and twists and turns with your hormones that can make a person symptomatic. So
Yeah. And just to add to that, the musculoskeletal pain, joint pain,
yes.
kind of brain fog, difficulty with cognition and making decisions, and feeling of malaise.
Yep. A good time.
Yes. Magical.
Wonderful.
It's
a
like
wonderful experience
being 13 all over again.
I know. I'm like, why don't they make us fun little books with pictures and stuff that like your mom slides under your door when it comes to menopause?
Yes, frozen shoulder, adding to that, yes. It's pretty hallmark to have that frozen shoulder syndrome set in right around that time as well.
It makes you, I always wonder, it's hard enough being a woman in 2024, and I think about women in like, the Victorian ages or before, like probably had all these weird random symptoms, and they were just getting treated like, you're hysterical, you're crazy, this and that. And I always think about that. I'm like, oh my God, those poor women, you're not crazy. It's menopause.
It's so true. They also had cholera, so
there was that.
So many challenges.
I know. But they had cool clothes though. But yeah, I mean, just the way, like, you would think frozen shoulder, what the heck does that have to do with menopause? Like, it truly does affect pretty much every system in your body. Like, you can see gastrointestinal changes, constipation worsening, diarrhea worsening. I think somebody wrote in there like food sensitivities, like these things that you're like, this didn't used to be my normal. What's going on here? So it is a big shift in your body.
Metal sensitivities. I've had patients that were suddenly allergic to their wedding rings or their watches and all of those too. I thought, and that ties along with skin sensitivity.
Mm-hmm. Interesting. Absolutely.
Someone wrote, imagine having hot flashes with all those layers, all the petticoats, all the dresses. I know. They had fans.
All the time they thought women were like swooning. It's like, no, they're suffocating.
They're bagel. They've gone bagel.
I know. He's passed out on us. He's no longer conscious. Oh, that's such a good point. So, at least we can wear, at least now the recommendation is like wear breathable clothing, not like tie your corset on tighter.
Oh boy. Yeah.
But yeah, so bleeding, super common, especially with hormone therapy. But just, I would say, don't panic. You don't need to panic. It doesn't mean you have cancer. But, we got to monitor it and see what we need to adjust. Estrogen's kind of like the building blocks of the uterine lining, and then progesterone comes in and either kind of helps it be like, let's stop building, but it also stabilizes it so that those bricks don't fall down. It's like the mortar, you could say, in between the bricks to like keep things stable so you don't have bleeding. So they work together.
I like that analogy.
Because I'm very handy myself, and I can very knowledgeable in sick lane.
Progesterone.
Exactly. They're doing a lot of construction in my neighborhood. The next time I see them, I'm like, did you know?
Oh, well, thank you so much, Andrea. This has been great. And we'll see each other back here in 2 weeks, and we will be discussing another hormone menopause related topic then as well. So stay tuned.
Hi. Looking forward to it. Thank you.
Have a good rest of your day.
You too.
Bye.